Hello, welcome to this short video where we're going to talk a little bit more in depth with Leanne Summers, our Head of AI Strategy, and myself, Indra, the Director of the NHS AI Lab, about our National AI Strategy for Health and Care. Leanne, do you want to take us through a few of the top themes that the strategy's pulled out and some of the findings that you found with some of the communications and engagement you've done so far?
Absolutely. I'd love to talk about our vision, if that's okay. So we started with a range of research activities, so primary research, secondary research, looking both at the landscape of artificial intelligence from different industries and different countries, both in health and outside of health. AI is obviously not just applicable in health. So that gave us a foundation for, what good might look like. Obviously, you've been leading on the lab for a number of years now, and that's just, the inception of AI within health. But what can we do to kind of take that into the mainstream? We then conducted some primary research, which was direct sort of interviews with stakeholders, key opinion leaders across artificial intelligence in health and care. And then also ran a public survey with over 1,000 respondents just to get a temperature check of kind of what does the public feel about AI. It obviously can be misconstrued as being robots and scary things. Yeah. And certainly the sentiment was people can see the benefit, but there's a bit of fear still there. So we've got some things to address there. And then with our stakeholder interviews, it was really useful for us to hear some of the barriers that people still think to the adoption and spread of artificial intelligence. And I think that's led to us generating kind of the vision and missions that we've got here to talk about today.
Great. And one of the key visions that we'd had with the NHS AI Lab when we started out was really about both the development and deployment of safe, ethical and effective technologies into the health and care system. So how do we see our vision changing over the next, say, 5 to 10 years?
I think that so safe, ethical and effective, absolutely.
Yeah, keeping that in.
Yeah, we don't want nothing scary here. So that's definitely there, but I think we've got the opportunity with artificial intelligence for us to move the health system forward to be more data driven, using insights rather than just analytics, and routinely using our data kind of more methodically with the with the aid of machine learning, artificial intelligence technologies, in order to basically, one of my favorite things to say is like automate the mundane, take the boring work away and get to actually delivering perhaps more personalised medicine and efficiencies. There's a lot of back-end processes that everyone's life would be easier if they weren't the way that they were. So obviously AI alone can't do that, but it can certainly help. And some of the things that we're thinking about is the ways in which we can enrich pathway transformations with some of these technologies so that we improve health and care outcomes.
Yeah. And so through the research, through the engagement, we've come out with some top 3 themes, so to say, that we're focusing on. And the idea is very much a kind of a practical, here are areas we know through both the award, through the research we've done, but through the skunkworks programs as well, where we're seeing in real life technologies being implemented. So can you talk me through those sort of top 3 themes that we're looking at?
Yeah, definitely. So we've got 2 themes that are looking at kind of the demand signaling functions. So what are the opportunities within health and care? So one focused around data, looking at population health, population insights, both at national levels, but regional and importantly local as well. I think there's perhaps a lot more happening locally than we even necessarily understand. So it's kind of what opportunities is there for learning, sharing and spread of some of those data opportunities. And then so one is looking at data, the other one's turning it on its head and looking at need. So if we're transforming a pathway to enhance a midwife's experience of delivering care for somebody who's pregnant, for instance, we may have user researchers involved in that journey, or process service improvement people, but they might not necessarily be thinking about the data that ought to be collected in a way that means that a machine learning technology may then add some extra efficiencies into the pathway. So there are 2 kind of main kind of needs generation. Yeah. And then we've got a kind of a bit around that, which is for safer scaling. So where the opportunities exist, where the AI is proven to be working, where it's safe and effective, what are our mechanisms to help us scale that, and how do we think about the regulatory system, the reimbursement systems, the commercial opportunities as well, to make sure that that's the products are able to scale. We've also got a lot of work to do with the leadership within the NHS to help them to understand the art of the possible with AI. It's workforce, from a trust perspective, is this something that they can trust? Radiologists plus, as an example, but also it's important, that our leaders actually understand the technology that is available to them to help make their lives and also the life of their workforce easier.
And with all things in technology and transformation, this is obviously a very complex landscape. And one of the things we're trying to do with the lab as a whole is obviously bring lots of different arms together. For example, we work very closely with the regulators, we work with the education system, Health Education England. And so quite often, I think when we're talking about strategies, people want to understand the tangible, the use case. Do you have one or two use cases where you can really say, yes, here's where AI is making a difference, and where we really see by pushing this particular theme or area, we can really drive it forward?
Yeah, absolutely. I think the lab already is using imaging, both with the COVID chest imaging database and then future platforms. There's a lot of opportunities there for us to actually start that scaling. Start answering some of those questions for scaling, and just mainstream some of the work that's already happening within the lab. So I think that's one of our big opportunities. And then some of our awardees as well, in stroke pathways, cardiology pathways, that kind of thing. There's a number of opportunities there. Also urinalysis, people's self-care, can you dipstick your pee, at home and get a result sent to you? And actually, yes, you can. So obviously we've got to, ensure we've got sufficient evidence for that to be something that we actually adopt, and it has to be cost effective as well. We are the NHS after all, but there's a lot of potential there. So yeah, definitely some examples. Also from the skunk works, they're looking at things like bed management at the moment, and it's really proof of concept. But it's really important for us to work with our partners, across NHS England Improvement. And the whole world really, to make sure that we can embed or socialise, the opportunities to see whether or not the technology itself really does, help improve outcomes.
Yeah. That's great. And we've done quite a bit of research with colleagues like Nurio, the National Institute of Health Research Innovation Observatory, have looked again at the evidence and the academic literature of where AI is really making an impact, and it echoes what you said around cardiology, imaging and brain images in particular. So moving forward, I'm conscious we're running out of time slightly, but what's our ask? What's your call to action here for everyone?
Great. Okay, so thanks thanks for the opportunity to talk about this. So we are launching this video today to marry up with the Office of AI Strategy, which hopefully is launching soon. Our engagement, our exercises over the next 6 months are to engage on the strategy. So we've got vision and missions. They're available on the website and also through the AI Lab Virtual Hub. And we also have a draft narrative that is available. It's very draft. It's purposely very draft because we may not know it all. I'm relatively new in post, there's an opportunity for me to learn here and the rest of our team to learn in helping shape this right. So we really want to engage local leaders, regional leads, that kind of thing, as well as across industry and academia to understand whether or not this is actually going to hit the mark. Is this going to help us get to a vision of a learning health and social care system by 2030? It feels like we might be in a good place. So I'm optimistic, but we're only going to get it right if we do it with you. So we need your feedback. Please get involved.
Brilliant. Well, thanks, Leanne. And so call to action, do take a look at the website. We've got lots of content on there, also on our virtual hub, and all the details are below. Cheers. Thanks.